Department.
This conference will now be recorded.
We are going to hear from Erica Lattenbach, Whatcom County Health Department Director, and Amy Hockenberry, who is the lead of our vaccine planning efforts today. Just a couple other reminders as we get started. One is an announcement that I want to make folks aware of. Starting Monday, January 18th, we are going to be transitioning away from the email address that we have been using thus far for our media partners to get in contact with us. We'll be switching to a different email address, and you can expect those details later this week. We will send out that information. But I just wanted to flag that for your attention now. And then lastly, just a reminder that we are recording this session, as you heard us start the recording just a moment ago, and it will be available later this afternoon on the Whatcom County Government YouTube channel and on our media page at www.whatcomcounty.us/COVID. And with that, I am going to go ahead and turn things over to Erica Lattenbach to get us started.
Thanks, Melissa. Molly, could you make me a presenter, please? And it looks like my chat feature's disabled at the moment, and as is my camera. So our continue. Okay, thank you for that, Molly. I'm going to share my screen with you in service of providing information. And for those of you who may have tuned in to the County Council meeting, this will look very familiar, but I think it's worth stating as many times as necessary in order to really help share these messages. So Whatcom County is in a dangerous position with our caseloads and with the magnitude and rapid increase in cases that we've seen in the last few weeks. And I want to share with you what we've seen since we've started this. This is our cases by month, starting March 11th. Oh, and Melissa asked me to make these a bit larger, so I will do that. Is that a little bit easier to see, Melissa?
It's about the same.
About the same. Okay, well, there we go. Let's. Is there another way that I could better maximize?
I think that's fine. And if folks have trouble seeing, we'll be able to share these out after the call.
Of course. Thank you. Thank you. So I do want to share these cases by month, and as you can see, we've remained at a pretty moderate level for many months, and our sort of our highest rate month was okay. I think there, yes, there I am able to turn my camera on. Our highest rate was in number of cases was in December, and we started talking about the surge in cases back in November and had some really serious concerns about what we were seeing in the trends. And so you can see we had just over 800 cases in November. We had almost 1,100 cases in December. And what we're seeing just in the first 11 days of January is we've already experienced 836 cases, which puts us on track to triple our previous month high and almost double the number of cases we've had since our very first case on March 11th in a single month. What's more concerning is we're noticing, and I'm going to share the next slide, and this may be slightly difficult to see, but I will share with you that we are seeing increases all over the county. This is not confined to just one jurisdiction or one school district boundary. We are seeing increases throughout the county. However, in the Linden School District boundary, which is this red line, that is growing precipitously, as is the Nooksack Valley. So those two areas are of particular concern, but we're concerned about increases countywide. We are also concerned about the rates by age. This is not limited like it has been in the past, or to a certain age group, or a high number in a certain age group and minimal in other age groups. We're seeing increases in every age group. And I will just point your attention to a couple of the lines that are concerning to us. If you see this black line here, this is the 80 years old and over, and the blue line just above it is 60 to 79 years. These are significant, of course, because the risk of severe illness and death are higher in these age ranges than they are in other ages. And these surges that we're seeing are not just limited to, in the past, it's been that 26 to 39. We have increases everywhere. However, more modest rates at these levels, we are still seeing increases. Also concerning are the increases we're seeing among 0 to 17-year-olds. For the first time ever, 0 to 17-year-olds now have the highest rates of infection, of new infection in our county. So this is not a surge that we're seeing in one part of the county or in one age group. It is throughout the county and of all ages in our county. And as you can see here, this certainly makes it appear, and we have not been able to see anything to conflict this. This does look as though Whatcom is an anomaly in our region and in our state. Whatcom's rates are rising far higher and far faster than any of the other counties in our region or in the state. There are some modest increases elsewhere, but for the first time 2 days ago, Whatcom County's case rate exceeded the state average. That has never happened before. We've been far below the state average. So this is all very concerning news for us, and I will share, this is what we're seeing in terms of the state trends, and this is the risk assessment dashboard available on the state's website. So as you can see, modest flattening, modest increases. There's not a lot of activity that looks different or concerning, whereas as you can see in Whatcom County, we are at an almost vertical line in terms of increases. In contrast, Skagit County not seeing these trends. San Juan, and San Juan is, if you look at the case rate, we're in the 40 to 50 cases per 100,000 case rate because of the smaller community. Island trends, and even Snohomish County. We are an anomaly in the state, and we do not know why. We have looked into a few different options, one being that because we have a local, I'm actually going to stop sharing my screen and happy to share those slides following the presentation. We looked into the possibility that potentially we were seeing increases early because we have a local lab that is turning around results. That does not appear to have trued out over the last few days or the last week, as more and more counties are reporting new data. We wondered potentially is a variant present in Whatcom County? Is the UK variant here in Whatcom County? And we've conferred with Northwest Laboratories, our local lab, and with the state. The state is following up. However, Northwest Laboratories is monitoring for markers of that variant, and they have not been able to identify any markers consistent with the UK variant since the beginning of this. We also, wondered if there might be something else. Was there a super spreader event? Was there a large event of 300 people that may have caused this incredible increase at a very fast rate? And from our case and contact investigations, we have found that that is also not the case. There are 6-8 people associated with an event on average, but not 20, 30, 40. There is no single or no few events that we can attribute to these increases. So we are continuing to engage with the state. We've asked our state epidemiologist and his team to look at the data and compare it to the data that they have on other regions and other counties. But thus far, we do not have a good explanation for why Whatcom County appears to be an anomaly statewide. That said, we are in a precarious position, and we know that these, from our case and contact investigation, these increases are largely consistent with what we've seen in the fall and winter, largely due to social events and household contacts. In fact, the week following Christmas, of the cases where we were able to identify a transmission site, 80% of those cases came from social events and household activities. We knew that there would be a post-Christmas and post-New Year's surge, but this is beyond anything we could have imagined, and it is incredibly concerning for us. I want to share that based on the case rates we have in our county, and of course this varies, and in certain areas of the county, like Nooksack, where they're at almost 1,000 per 100,000 case rate, the risk is higher. But on average, based on our average case rates, if a person gathers with 10 other people, they have a 12% chance of contracting the virus. If they gather with 25 other people, they have a 28% chance of contracting the virus. If they gather with 50 other people, they have a 1 in 2 chance. They have a 48% chance of contracting the virus. And if they gather with more than 100 people or around 100 people, they have a 72% chance of contracting the virus. We recognize that people are fatigued, that they are ready to move on, that they are excited about the vaccine. And we also recognize that we all place a different level of risk on strangers versus people we know and love. But it truly is among people we know and love where this transmission is happening. It is gatherings, it is parties, it is social events, it is sharing meals with people we know and love that is causing this. And we have to protect our hospital capacity, and we have to be able to get these rates down so we can move forward. Our businesses are hurting, and our businesses cannot reopen until we discontinue the gatherings. We urge people to please stop gathering so we can reopen our businesses. Our economy is hurting, our businesses are hurting. Whatcom County is holding our region back from being able to move forward, and we have to be able to do that in order to recover. With that, I want to turn it over to Amy Hockenberry, who is our vaccine planning lead, who will talk a bit. I get to share the bad news, and Amy can share the good news, and I will let her talk about our vaccine planning efforts.
Okay, thanks, Erica. Yeah, I just want to give a brief update, status update on where we're at with vaccine administration and our current planning efforts. So as of today, or basically this week, we have a little over 9,000 doses of COVID-19 vaccine that's been allocated to Whatcom County. And this includes 800 doses that are being shipped this week. We're now at 17 sites that have been approved by the Department of Health as an enrolled provider, and we still have more than double that number that have pending applications to become enrolled providers. We're still working to publish the number of vaccines that have been administered to our county, but to date, we're still not confident in the accuracy of the data reported from Whatcom County. However, the Department of Health is planning to report county level vaccine administration, and we're told this will be published on the Department of Health dashboard as soon as today, which is dashboard is also on our website. So we'll be working with the Department of Health to confirm the accuracy of what they publish so that we can be confident in the administration numbers moving forward for regular updates. As you know, last week, the Department of Health rolled out plans for next stages of vaccination in our state. This is providing specifics about vaccine phase 1B, tiers 1 through 4. I also want to let everybody know that all of our skilled nursing facilities and assisted living facilities in Whatcom County have been paired with a pharmacy to be administered their COVID-19 vaccines. And this is also for staff and residents. And they're either scheduled for vaccine appointments or they've already received their first dose. So that's really good news for Whatcom County. For many of the phase 1A workers who work at a facility who are not enrolled providers are being vaccinated by other enrolled providers. And we've mentioned we've been working to coordinate connections with those. The last thing I want to share is that we're really pleased to announce that several large healthcare providers in our community have committed to collaborating on executing large-scale community vaccine clinics that will be open to anyone. This commitment is an important first step, and we applaud and we're very grateful for the way these healthcare providers have stepped up to the challenge of getting our community vaccinated. We're in the very early stages of this planning, but we'll be sure to share more details in the coming weeks. So that's my update for vaccines at this time, and I believe I'll be passing it back to Melissa.
Yeah, thanks, Amy, and thanks, Erica, for those updates. So as I mentioned in the chat just a minute ago, this is the time to ask your questions. So members of the media, if you have questions to ask of our speakers, go ahead and type your name and your affiliation into the chat, and we will call on you in the order received. All right, our first question is from Joe Tehan with KGMI. Joe, go ahead and unmute yourself to ask your question.
Okay, thanks. For Erica, the high rate of infection we're seeing locally among especially young people, is that expected to affect how schools approach reopening or expanding, having more kids in school at this point?
Good question. We are actively working with all of our school district superintendents. Our health officer actually has a meeting with the superintendents tomorrow. This is a challenging gray area because we know that students will thrive when they come back to school, and we want to get them back to school as soon as possible. We are concerned about the rates that we're seeing, and we're trying to balance the benefits and the challenges associated with getting kids back to school in person. So more to come on that.
Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, Melissa, thank you. This is for Erica, kind of in a two-parter kind of. Are you feeling supported by elected officials? And also, what do you think elected officials or the health department could do to persuade people who are continuing to ignore the guidelines? Thanks.
Yeah, well, I've had good conversations with elected officials who really do want to support us. Elected officials from our state delegation and our cities and our county, and they recognize the need to make sure that we get out messages about gathering. You know, I think one of the most compelling messages that we can send, and when I say we, I don't mean me. This isn't about getting the case rates down just because we need to get the case rates down to reduce the burden of disease in our community. This is also about the impact that these case rates are having on our ability to reopen businesses. And we are working to engage with our business community to make that connection for people. I feel like that's a really compelling message. And we know that businesses are hurting. Small businesses have been really impacted by this. A lot have closed, some have closed permanently, and we want to support them. And we cannot reopen businesses legally based on the new roadmap to recovery. And we cannot support businesses unless we as a community work to limit the spread and reduce the spread. So we are working on that as well, trying to engage with our business community who have really been disproportionately impacted.
Thanks, Erica. Our next question is from Tom Botsey with Northwest Public Radio. Tom, go ahead.
Hi, thank you. Question for Amy. I'm curious to hear your take on the calls from as high as the Health and Human Services Secretary to speed up the wider rollout of the vaccine, especially to seniors and people with comorbidities. What are the possibilities for doing that?
Yeah, I believe you're referencing the announcements that just came out yesterday from the federal government. Is that correct?
Correct.
Yeah.
And we've also the teachers union, for that matter, who want to bump teachers up faster. But yeah, I think it's seniors in particular that are agitating.
Yeah, that announcement's a significant shift from the months of careful planning that the Department of Health and the Governor's Office have done ahead of rolling out the vaccines. There's no firm decision yet, but leaders from all of the public health jurisdictions and the state are convening to discuss how to move forward regarding that announcement coming out yesterday. We do have concerns, about moving so quickly towards a broad scale implementation, particularly when right now there's such a small or a short supply and a small trickle of vaccines coming into the community. So as I mentioned earlier, there was just only 800 doses that came into Whatcom County this week. So we're hopeful that will speed up, particularly with the new administration coming in. But there is a fine balance between opening up for more people being eligible and with the supply being limited at this point. And then as far as the teachers union or just any other entities that are particularly interested in being eligible sooner versus later. The Department of Health has been really, and the Governor's Office really looking at the equity issues or the equity concerns and those most at risk of contracting or at high risk of having severe illness. So those are just two of major components of what has been weighing into decision making about priorities. And again, these decisions do reside within the Department of Health and the Governor's Office. And Erica, I don't know if you would like to add anything else.
No, I think you covered it well. We're really trying to balance risk and supply, and that's a challenge with so little supply and so many people still in our top tiers that have a high risk of infection.
And maybe just a quick follow-up. Do you have an estimated date then at this point or target for transitioning from group A1, A2 to phase 1B or B1 as it's called?
Yeah, right now we're looking at an estimation of being still in phase 1A for a few more weeks, and the next phase towards the end of the month and into February. Again, that decision is made by the Department of Health.
Thank you.
Yeah, and I just want to add and be clear that this is not for lack of administration. It's not for lack of healthcare providers that are ready and able to provide vaccine. This is, we are moving at the pace we are based on the supply and the supply only.
All right, I don't see any other questions in the chat, but I'll do one last call here. Oh, and Joe sliding in there. Joe T and KGMI, go ahead.
Thank you. I'm wondering, Erica, if you have any indication we're seeing these increased cases as you showed that chart, but are the death rate here, at least in Whatcom County, has really slowed. That's a good thing. But do you have an indication why that might be? Talking about the death rate specifically, as we've seen a greater increase in infections.
Yeah, well, I will say that generally there's a 3 to 4 week lag from the time we start to see a surge until we start to see hospital intake and admissions. We are at our highest level for hospitalizations that we have had thus far. I can't predict the future. I can't predict how many of the people that are included in those numbers will have severe illness or will die. But we do have concerns, particularly among that 80 plus and 60 to 79-year-olds. So we are watching that closely. We are coordinating very closely with the hospital to make sure that they have all of the latest data so they can plan and for the worst and plan for what's possible.
Thanks, Erica. It seems like it's always my threat of last call of questions that brings in a few more. So I'll say it again. There's a couple in there, but if you want to get a question in, feel free to type your name in the chat. Next question is from David Rossbach with the Bellingham Herald. David, it sounds like we're getting a bit of just feedback on your audio. Do you want to give that another chance? Okay, I think we're not able to get your audio, David. So if you want to go ahead and type your question into the chat, I'll read it out. In the meantime, I'm gonna go on to Robert with the Herald. Robert, go ahead.
Thanks, Melissa. I was wondering, I heard you're running into some reluctance with contact tracing and also with sort of this cavalier attitude among some people that because the virus seems to be deadly for only a few age groups, why shouldn't we just return to life as normal? Would you mind speaking to that? Thank you.
Melissa, you should have cut off the questions before Robert asked his very challenging questions. Thank you for those. I think that's it's actually really helpful to talk through. So no person is an island. We are a community. And if we have different restrictions for people who are at risk of severe illness and death, they would be cut off from all systems of support, all healthcare services, all retail, grocery, other support services, family, friends, etc. We, of course, want to protect people who are at severe illness and death, but we have found that there's no way to do that effectively without protecting the rest of us as well. I also want to share that while in Whatcom County, we have not had deaths among people who are under 40, there are cases of deaths all over the country in younger people, and we don't know the impact that COVID will have on any person. Yes, the risk is lower for severe illness and death, but it is not without risk. And so we are balancing all of those challenges and really trying to protect the population as a whole. We recognize that this is a community and no person is an island. And honestly, what we're asking is for people to not gather, to not wear masks, to not be indoors with groups, and to wash their hands. I feel like if we can ask of those things, those simple changes that people can make, that we can protect everyone and we can move forward with reopening businesses and reopening our economy. We are not asking a lot from people. And I know that people are fatigued and they want to see, we are social creatures and they want to see their friends and family. But we can kick this. And frankly, we can kick it quickly if we all take collective action and recognize that we're doing this for our community, not just for ourselves. So I hope I answered both of your questions.
Thanks, Erica. Next question is from David Rossbach with the Herald. I'm going to read out David's question. He's asking, with only 800 doses of the vaccine shipped this week and 9,000 cases closing in a month of vaccination, has the state given any indication why Whatcom's allocation has been so low and when we might begin to see that pace pick up?
Yeah, so as far as the allocations out to the counties, so the Department of Health is working directly with the CDC, obviously, as shipments are coming into the state. And then they, as I mentioned, every week we have more enrolled providers. So that is also true across all of the counties as well. So they have looked at estimations of phase 1A eligible individuals across the whole state. And so they're weighing multitude of criteria about how many vaccines go to which providers across the state. So while that doesn't clearly state why maybe the lower dose allocations to Whatcom County or slightly different allocations, they are weighing multiple different criteria to make those decisions. And the number that are coming into the state has also shifted on a weekly basis. So they're managing that as well. And then as far as increase, I believe we're hearing the same thing that many of you are hearing, that more and more will become available as the weeks roll on, and potentially with this new administration coming in at the federal level. So that's the same message we're hearing from the Department of Health as we're hearing nationally too. So as more become available, more is manufactured. As you can imagine, there's a lot of steps to get from a national level down to a local provider logistically. So that just takes time, and so does the manufacturing of both of the currently approved vaccines.
Thanks, Amy. I'm going to do one last call for questions here. And a quick reminder again, you can catch the recording later today. It usually takes about an hour to 2 hours for us to just download that and get it up. It's going to be available on Whatcom County Government YouTube channel and at our favorite website, www.whatcomcounty.us/COVID. And I do not see more questions rolling into the chat. So with that, I'm going to close things out, and take care, everyone. We'll see you soon.
Thank you, everyone.